SWIM portal. Now we will discuss the fundamental rights and health. Article 21 of the Constitution and right to health care, the fundamental right to life as stated in the Article 21 of the Indian Constitution. Indian Constitution guarantees to the individual her or his life which or personal liberty except by a procedure established by law. The Supreme Court has widely interpreted these fundamental rights and has included in Article 21 the right to live with dignity and all the necessities of life, such as adequate nutrition, clothing. It has also held that act which affects the dignity of individual will also violate his right to life. The Constitution incorporates provisions guarantee everyone's right to the highest attainable standard of physical and mental health. Article 21 of the Constitution guarantees protection of life and personal liberty to every citizen. The Supreme Court in Bandhwa Mukti Morcha versus Union of India has held that the right to live with human dignity enshrined in Article 21 is derived from the directive principles of state policy and therefore includes protection to health. In Vention Pani Kulangara versus Union of India, the Supreme Court of India, on the right to health care observed, maintenance and improvement of public health have to rank high as these are indispensable to the very physical existence of the community, and on the betterment of these depends the building of the society of which the Constitution makers envisaged. Attending to public health, in our opinion, therefore, is of high priority, perhaps the one at the top. In a historic judgment in Consumer Education and Resource Center versus Union of India, the Supreme Court has held that the right to health and the medical care is a fundamental right under Article 21 of the Constitution. It is essential for making the life of the workman meaningful and purposeful with dignity of person. Right to life in Article 21 includes protection of the health and strength of the workers. The expression life in Article 21 does not connote mere animal existence. It has a much wider meaning which includes right to livelihood, better standard of life, hygienic condition on a workplace and leisure. The court held that the state, be it union or a state government or an industry, public or private, is enjoined to take all such actions which will promote health, strength and vigor of the workman during period of employment and leisure and health even after retirement as basic essentials to life with health and happiness. The right to life with the human dignity encompasses with its hold some of the finer facets human civilization which makes life worth living. The court accordingly laid down the following guidelines to be followed by all asbestos industries. In Kirloskar Brother Limited versus Employees State Insurance Corporation, the Supreme Court, following the Consumer Education and Research Center case, has held that the right to health is a fundamental right of the workman. The court also held that this right is not only available against the state and its instrumentalities, but even private industries to ensure to workmen to provide facilities and opportunities for health and vigor of workmen ensured in the provisions of Part 4 of the Constitution, integral part of the right to equality under Article 14 and right to invigorated life under Article 21, which are fundamental rights to the workman. Further, in the state of Punjab versus others versus Mohinder Singh Chawla, it has been held the right to health is integral to right to life. Government has a constitutional obligation to provide health facilities. Similarly, the court has upheld the state's obligation to maintain health services apart from recognition the fundamental right to life as an integral part of the right to life. There is a sufficient case law both from the Supreme Court and High Court and lays down the obligation of the state to provide medical health services. In numerous cases, the Supreme Court held that right to health and medical care is a fundamental right covered by Article 21, since health is essential for making the life of workmen meaningful and purposeful, and compatibility with the personal dignity. Right? Article 23 is indirect related to health. Article 23, subclass 1, prohibit traffics in human beings. It is well known that the traffic in women leads to prostitution, which is to a major factor in spread AIDS. Article 24 is relating to child labor. It deals with no child below the age of 14 years shall be employed to work in any factory or mine or engage in any hazardous employment. Thus, this article directs the relevance to child health. Article 26 gives special protection to religious dominations. Both can be enjoyed by any person subject to public order, morality, and health. And other provisions of the respective part of the Constitution, the person has a right to enjoy this freedom, but it should not adversely affect the right to others, including that of not being disturbed in their activities. The Supreme Court in Paschim Banga Khet Mazdoor Sanity Samiti and others was the state of West Bengal and others, while widening the scope of Article 21 and the government's responsibility to provide medical aid to every person in the country, held that in a welfare state, the primary duty of the government is to secure the welfare of the people. Providing adequate medical facilities for the people is an obligation undertaken by the government in a welfare state. Article 21 imposes an obligation on the state to safeguard the right to life of every person. Preservation of human life is thus in paramount importance. The government hospitals run by the state are duty bound to extend medical assistance for preserving human life. Failure on the part of the government hospitals to provide timely medical treatment to a person in need of such treatment result in violation of this right to life guaranteed under Article 21. The court made certain additional direction in respect of serious medical cases. Adequate facilities to be provided at the public health centers where the patients can be given basic treatment and his condition is stabilized. Hospitals at the district and sub-divisional level should be upgraded so that serious cases be treated there. Facilities for giving specialist treatment should be increased, and having regard to the growing needs, it must be made available at the district and sub-divisional level hospitals in order to ensure availability of bed in any emergency state level hospitals. There should be a centralized communication system so that the patient can be sent immediately to the hospital where bed is available in respect of treatment which is required. Proper arrangement of ambulance should be made for transport of patient from the public health center to the state hospitals. Ambulance should be adequately provided with the necessary equipments and medical personnels. Medico-legal keys and right to health care and medical assistance. This has been explicitly held that regard to the provisions of emergency medical treatment in Pandit Paramanand Katara versus Union of India. It was held that it is the professional obligation of all doctors, whether government or private, to extend medical aid to the injured but immediately to preserve life without waiting legal formalities, to be complied with the police under CRPC and Article 21 of the Constitution casts the obligation of the state to preserve life. No law or state action can intervene to delay the discharge of this paramount obligation of the members of the medical profession. The obligation being total, laws of procedure, whether in state statutes or otherwise, which would interfere with the discharge of this obligation, can be sustained and must therefore give way. This is a very significant ruling of the court. It is submitted that if the decision of the court is followed, in its true spirit, it would help in saving the lives of many citizens who die in accidents because no immediate medical aid is given by the doctors on the ground that they are not authorized to treat medico-legal cases. Let us hope that all doctors, government or private, of the country should follow this ruling of the court earnestly. Medical examination of rape victims and right to health care. It was a common practice among the doctors to refuse to examine the rape victims unless she is not referred by the police. However, the Supreme Court in the state of Karnataka versus Manjana, it has been recognized the right to the rape victims medical examination and disapproved the refusal of some government hospital doctors, particularly in rural areas where hospitals are few and for between to conduct a medical examination of a rape victim unless the case of rape is referred to them by the police. Such refusal to conduct the medical examination necessarily result in a delay in the ultimate examination of the victim, by which time the evidence of the rape may have been washed away by the complainant herself to be otherwise lost. Working of blood banks and right to health care. The instrument of public interest litigation used by the common cause addresses the issue of the working of the commercial blood banks, where the court in the common cause versus Union of India and others, while recognizing the blood donation is considered as a great life-saving service to humanity, it must be ensured that the blood that is available with the blood bank for use is healthy and free from infection. The Supreme Court in this case laid down a system of licensing of blood bank. It may be inferred from the above reasoning that the state is entrusted with the responsibility in matters of health to ensure the efficient functioning of all centers relating to health care. Case of HIV, AIDS and right to health care. Recently, the Supreme Court has addressed the epidemic of HIV AIDS in case where the court had to decide where an HIV positive man should disclose his condition to the woman he has to marry. The court has held that the woman's right to health took precedence over the man's right to privacy. It found that the hospital did not err in disclosing his status to his fiancée. Living and working condition of workers and the right to health care. While the provisions of health services is essential to ensure good health, there are several other factors that influence a person's health. The Supreme Court has recognized this in a number of ways. This was the first address in Badwa Mukti Morcha versus Union of India, a case concerning the living and working condition of some stone quarry workers, whether these conditions deprive of their right to life. The court held that the human working conditions are essential to the pursuit of the right to life. It lays down that workers should be provided with medical facilities, clean drinking water and sanitation facilities so that they may live with human dignity. The citizen and inhabitants of municipal ward versus municipal corporation Gwalior, in this case, the court deliberated on the question, is the state machinery bound to assure adequate condition necessary for health? The case involved the maintaining of sanitation and drainage facilities by municipal corporation. It was held that the state and its machineries, in the instant case, the municipal corporation are bound to assure hygienic conditions of living and therefore health. Mentally ill persons and right to health care. There is a sufficient case law on the issue of health in the state, running institutions such as remand homes for children and care homes. In Sheila versus Union of India, and another, a case pertaining to admitting of non-criminal mentally ill persons to prisoners in West Bengal. The Supreme Court has held that admission of non-criminal mentally ill persons to jail is illegal and unconstitutional. The judicial magistrate will, upon a mentally ill person being produced, have him or her examined by a mental health professionals, psychiatrists, and if advised by such psychiatrists, medical health practitioners, send the mentally ill persons to the nearest place of treatment and care. It has further directed the state to improve mental health institutions and integrate mental health into primary health care among others. Further, in Sheila versus State of India and others, the Supreme Court has entrusted to the High Court the duty to monitor the condition of mentally ill and insane women and children in prison and pass appropriate orders from time to time. In the most recent case involving the death of 25 inmates of mentally ill mental health institution in Iravadi, Ramanathapuram district, as they were chained to poles or beds and could not escape from the fire that broke out, the Supreme Court has directed the state to implement the provisions of the Mental Health Act as well as to undertake a survey of all institutions that provide mental health facilities and ensure that they are maintaining standards of care. Section 81 of the Mental Health Act 1987 has provided that mentally ill persons be treated without violation of human rights, biomedical waste right to health care, biomedical waste management and handling rules 1998 and the biomedical waste management and handling amendment rules 2000 was notified by the central government in exercise of the power conferred by section 6, 8 and 25 of the Environment Protection Act 1986. The Act makes it a duty of every occupier of an institution generating biomedical waste, which includes a hospital, nursing homes, clinic, dispensary, veterinary institutions, animal house, pathological and laboratory, blood bank, by whatever name called, to ensure that such waste is handled without any adverse effect to human health and environment. Now, the pollution and right to health care. In Santosh Kumar Gupta versus Secretary, Ministry of Environment, New Delhi, contended that the policy control, regulation and their implementation are inadequate, thereby causing health hazards in its judgment. The High Court of Madhya Pradesh has laid down that the pollution from cars poses a health hazard to people and the state must ensure that emission standards are implemented, maintained. In the landmark MC Mehta versus Union of India, the Supreme Court has held that environmental pollution causes several health hazards and therefore violates right to life. Now, in conclusion, from the above discussion of cases, it is evident that the judiciary has clearly read out Article 21, right to life, the right to health. It is the fact that it has gone deeper. It has gone deeper into the meaning of health and has sustained the meaning of right to life. The question is that must be discussed more thoroughly is whether an amendment to the Constitution which will state the fundamental rights to health is desirable. Enumerated rights have an edge over wider interpretation of existing rights as the state can held accountable for violation. However, with the extensive case law that is available, is it not possible to use that is available to ensure that healthcare facilities and condition ensuring health are fundamental rights of every citizen. If the case law reflects the ability of the court to read the meaning of health in every wide sense, everything from the responsibility of the municipal corporation to provide sanitation facilities down to access to emergency medical treatment has been interpreted in the right to health, then why not use the instrument of case law to confirm rights in this question that must be examined in the light of the recent amendment guaranteeing primary education for all. The process that led us to the amendment must be looked at critical as well as how the implementation of it is currently taking place. An amendment guaranteeing The right to health should have a focus on primary health care, which is preventing and curative. It should also have a specific focus on the health of women, more specifically reproductive health, children and the disabled, both physically and mentally. Keeping this in mind, there must be more detailed examination of an amendment to the Constitution guaranteed to the right to health. Thank you so much.